there is no correct balance between acceptance and change. On one hand, acceptance and change, they're not mutually exclusive, but on the other hand, there will not always be a nice, clean harmony between these two competing needs. So the ratio between how much acceptance and how much change a client needs is in constant flux. And it'll depend on any given client and any given situation. Therefore, it requires clinical judgment on the part of the therapist. It also requires attunement to the client and their ongoing needs. So when in doubt, when you don't know how much acceptance or how much change to focus on, you can follow this formula. Validate, 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 skill. But what if you're working with a client that is stuck on either acceptance or change or both? Well, something that can be helpful is the stages of acceptance that we've all heard about. Denial, anger, bargaining, depression, and acceptance. Or the stages of change that we've all heard about. Pre-contemplation, contemplation, preparation, action, and maintenance. Did you notice that both of those models have 5 distinct levels of change? When I'm working with a client and I'm not quite sure where they're at with acceptance or with change, or they're stuck on acceptance or change, or stuck on both, a lot of times what I'll do is I'll take a look at these 5 different stages of acceptance and 5 different stages of change and see where the client is at. And if they're stuck on one of the stages of acceptance, maybe stuck on denial or anger or bargaining or stuck on depression, what I'll do is literally do some grief counseling, because that is what grief counseling is. Grief counseling is figuring out which level of non-acceptance are you stuck at. Work through that on your way to acceptance. Or maybe the client is stuck on one of these levels of change, either pre-contemplation or contemplation or preparation or action or maintenance. Once again, I've helped the client figure out which of those levels are you stuck at, and from there, do motivational interviewing. In other words, both grief counseling and motivational interviewing can be very helpful adjuncts to DBT, especially when a client is stuck on either acceptance or change.